video is all about the procedures of normal delivery. The definition of labor is a physiologic process that begins with the onset of rhythmic contractions which bring about the changes in the biochemical connective tissue resulting in gradual effacement and dilatation of the cervix and end with the expulsion of the product of conception. To differentiate between true and false labor, they differ according to the intensity, duration, interval, frequency, pain, aggression of cervix. The first stage of labor starts when painful contractions become regular, 5 minutes apart for 1 hour or more than 12 contractions per hour, ends with cervical dilatation. The second stage of labor begins with complete cervical dilatation of 10 cm and ends with fetal delivery. The third stage of labor. The 7 cardinal movements of labor are engagement. The biparietal diameter passes through the pelvic inlet in many nulliparous. Engagement happens even before labor begins. Second is descent due to pressure of the amniotic fluid, pressure of fundal contractions, maternal effort, and straightening of the fetal body. Third is flexion. Fourth is internal rotation, where the occiput moves toward the pubis symphysis. Extension, due to two opposing forces, which are pressure of fundal contractions and resistance of pelvic floor. External rotation or the restitution, and finally expulsion. The essential intrapartum newborn care protocol has the following steps. First, the newborn is immediately and thoroughly dried. This step stimulates the newborn's breathing. Second, the newborn and the mother must come into physical contact with each other for at least 6 hours. This is done to prevent complications such as hypothermia, infection, and hypoglycemia. Third, the umbilical cord of a newborn is clamped for 1 to 3 minutes, or when the cord pulsation stops. The proper timing of umbilical cord cutting and clamping helps prevent a newborn's brain from bursting a blood vessel and bleeding. Fourth, the mother and her newborn are kept close and early breastfeeding is implemented. Early breastfeeding gives a newborn a substance called colostrum, which boosts a newborn's immunity against diseases.